Good morning, everyone. Welcome back from the weekend. I hope you had a great time. My name is Shannon Hansen. Today I'm here to teach you about prepping a patient for a cardiac cath lab procedure. So we look at getting a patient ready for the procedure as a three-phase process. The first phase being prepping the patient, the second phase being draping the patient sterilely, and the third would be the procedure in itself. For the purpose of today, we're just going to focus on the first phase, which would be prepping the patient for the procedure. So by the end of today, you as new cath lab nurses, my goal for you is that you will be able to apply the electrocardiogram leads, the blood pressure cuff, and the pulse oximetry probe appropriately. You'll be able to apply the nasal cannula and initiate oxygen therapy. You'll be able to assess the IV site, making sure it functions, and then the last step, you'll be able to appropriately prep the groin for the procedure, the access site. So when we look at getting a patient ready for a cardiac cath procedure, in the phase one of prepping the patient, there's 4 steps that we're going to think about, okay? I'm going to use that term a few times, 4 steps, just to help get that in your mind so that as you are getting ready and you're starting to hook up the patient and do things down the road, you'll be able to remember that there's 4 things I have to do to make sure you don't forget things. So the first step would be setting up the equipment for the patient, on the patient. The second, again, would be the oxygen, getting that ready. Third, assessing the IV. And fourth, getting the procedure access site ready. So the first phase of the, or first step I should say, of getting it ready would be putting the equipment on the patient. We use a 5-lead electrocardiogram system. ECG, you'll also hear that synonymous term with electrocardiogram. You'll use a non-invasive blood pressure cuff and then also a pulse oximetry probe. In the cath lab, we use a 5-lead ECG system. Now, some of you may be familiar with applying that on the patient if you work on a telemetry floor. We set things up a little bit differently in the cath lab, and the purpose of that is simply so the wires don't get in the way of the view of the physician when they're looking at the heart under x-ray. Those wires would show up. So we set it up a little bit differently. So typically when you are having a patient with the 5-lead system, you'll have the right arm, the left arm, the V lead, and then the right and left lower limbs. We do it a little differently as mentioned. Instead of having the white lead, the RA lead, on the front side, we're going to place it in the back, about 1 to 2 inches on the shoulder in the back portion. Similarly with the left arm lead, which is colored black, that'll be behind the left shoulder, about 1 to 2 inches. Again, instead of that brown V lead being in the center of the chest, it's going to move to the left side, somewhere between the waist and the hip area for the patient. And instead of having the right leg lead be on the right side, we're moving that to the left side as well. So again, it'll be the right arm in the back, the left arm in the back, and then the V lead, the right leg lead, and the left green lead all along that side. Any questions on that placement? Is everyone getting that okay? Okay, let's move on. The next one would be the non-invasive cuff, applying that. You're going to apply that either to the right or left side. We typically try to avoid the side that the IV is on in case, just so that it doesn't interfere with the IV fluids that are running. Also, if there's a contraindication to a certain side, perhaps the patient is a dialysis patient with an AV fistula on their right arm, you're not going to put the cuff on that side. Or if they've had a mastectomy in the past, you're not going to put it on the side of that as well. So just be mindful of where you're putting the cuff, however it can go on either side. Once you get that cuff on, you're going to initiate the first baseline blood pressure measurement, and then subsequently every 5 minutes throughout the procedure, that cuff will automatically go off. Placing the pulse oximetry probe. So that can be placed on the first, second, or third finger, preferably on the left hand. Now simply that's just because it's typically the side opposite of where the physician works. So you want to just be able to avoid if the probe were to come off in the middle of the case, or you have to make any sort of adjustments, that you're not in the way of the physician trying to get that probe back on. So again, preferred on the left side. If needed, the right side is okay. Once you have that probe set up, you'll then get a baseline oxygen saturation while they're on room air before you place them on oxygen. Which brings me to the next step, and that would be oxygen placement. So typically we'll use a nasal cannula for that. We'll start them on 2 liters via that nasal cannula. If a patient happens to require more oxygen at a baseline, if they wear 4 liters of home O2, you'll start them at that amount as well. There may be times where patients have higher demand for oxygen, or they may even be on a ventilator, but for the purpose of today's discussion, we're going to just focus on the typical nasal cannula setup. You'll notice here in the picture that the oxygen tubing is in the center of the chest. It's important to move that to the side. So you'll just kind of drape that tubing either over the left shoulder or just down that side. Again, similarly to getting those cords out of the way that we talked about earlier, this is that same process. That tubing will show up in the x-ray, and you just don't want that to get in the way at all. Any questions on placement of oxygen? All right, let's keep going. The third step of getting a patient prepped for the procedure would be to assess the IV site. So you want to make sure that your IV site is functioning. So you'll look for a drawback of blood return, flush it with normal saline. You want to make sure that there's no infiltration, that there's no pain. Once you've established the IV site is working fine, then you'll connect it with 0.9 normal saline. And as far as what the rate would be, you'll defer to what the physician wants the rate to be. The fourth step of getting a patient ready for cath would be to get the access site ready. Now, there are different types of access sites that can be used, whether it be the groin site, the wrist, the arm, the neck, many different sites. But again, for the purpose of today, we're going to keep it basic, and we're going to just focus on the groin site. First and foremost, before you start anything, you want to explain to the patient what you're going to be doing to them at this point in time. This is a very vulnerable time for them. You're going to be lifting their gown up, bringing their blankets down, exposing their private area in a cold room on a hard table. It's very uncomfortable for the patient. Many times this is before sedation's been given, so they are wide awake. So, due diligence, explain to the patient what's going on and the importance of why you're doing it to try to alleviate any anxiety they may have. With that being said, you'll place a folded towel down the center. You'll then prep both groin sites by clipping with an electric clipper. We don't use razors anymore because it has a better chance of infection. So electric clipper only. You'll clip the groin and get that part ready. The next part, you'll take some tape just to remove the excess hair from that site. You're not depressing the tape in a strong fashion, so it's not sticking to the patient, it won't hurt them, but you're simply just removing the excess hair that they have. Once you are finished with that, you're going to clean the site with a ChlorPrep stick. As you see here, there's 2 wings here. You will depress those wings, which allows the solution to get to the sponge. And once that sponge is saturated, you're going to scrub pretty vigorously so you can create friction, and that friction helps to clean that site and prevent infection. So you'll do that to both sites with 2 separate sticks for 30 seconds. At the end of the 30 seconds, once you've cleaned both sites, you'll wait 2 minutes to allow that area to completely dry. Any questions on getting the access site ready? I know it's a lot of information, but very important steps to take. All right. So again, just to summarize what we talked about, the 4 steps of prepping the patient, which again is the first phase of getting the patient to the procedure, is going to be setting up the equipment, is going to be getting the oxygen ready and on the patient, is going to be, the third step is going to be getting the IV site ready, and then the fourth site is the access site. Okay? Any questions on those 4 steps at all? Good. So now's the time we're going to start some practice. We're going to see how well you do. So I'd like you to pair up and go through practicing on the mannequin of the 4 steps we talked about, getting the patient ready for their procedure. Okay? We'll take about 10 minutes to do that. At the end of the 10 minutes, we'll regroup and we'll talk about how things went. Okay? All right, go ahead and break. All right, welcome back everybody. How did it go? What were your feelings? Any issues, anything come to mind? It takes a little bit of practice to really get familiar with where the leads go, with how to, get the oxygen set up just in the right way, how to get the IV functioning and going, and the groin prep, the access site is usually the hardest part. So, sounds like everything went well. I'm glad. So again, this is just the first step, or the first phase of getting the patient ready. As we talked about, next week we're going to learn how to drape the patient in a sterile technique. The week after that is then we'll look to teach how to assist in the actual procedure itself. Okay? So just to review, remember there's 3 phases in getting the patient prepped for to get the patient ready for the procedure. Step 1 is what we focused on today. Are there any questions, last minute questions? Everyone has it? Great. All right, have a great rest of the day and I'll see you next week. Have a good one.